Hey guys, welcome back to McDonough Coaching for all things physio, training, nutrition and habit forming. Looking at lower back pain again. So we're going to kind of go through the process. So I went through one video of the gentle mobility, and then I talked about isometric strengthening, and today we're just going to talk mainly about functional strengthening. So if you've had back pain for less than 3 months, it's considered acute. If you've had back pain for more than 6 months continuously, more than 3 months, so it's kind of acute and chronic, and then kind of 6 months onwards, it's kind of chronic. So stage one, like I said, you're kind of doing your gentle mobility, your like knee hugs, and this is for for all back pain anyway. The knee hugs are specifically for the non-specific lower back pain, which is what that video is for, not disc, which is explained. And then you're gone and done some isometric strengthening, and some of these will kind of overlap depending on how bad your pain is. And then functional strengthening. So someone might come in with back pain, I might get them straight to functional strengthening. They might have already been doing some of those kind of things, or the pain's not too bad, and I can actually get them doing some functional strengthening. And what I mean by functional strengthening is exercises like squats, deadlifts, push-ups, pull-ups, overhead press, your core foundation kind of movements. And again, depending on the level, what variation. It might be a body weight squat through manageable pain ranges. So it might be the bottom of the squat that's very painful, and I'll get them to avoid that and just work on those manageable pain ranges. It might be an incline push-up. It might be some sort of pull, like a row or a banded row. It might not be deadlift. It might be some variation of that. So in this stage 3, if you're having physiotherapy as well, your physio is going to tell you to increase your walking. You might do some manual therapy, some soft tissue release, some joint mobilisations or manipulations of your spine, hip. You'll advise and educate you on things like work and other specific things to you. And then there might be some cognitive behavioural therapy advice as well, because there's evidence for that. There is no evidence for core stability. Nothing. No evidence at all. So if you look at a paper, The Myth of Core Stability by Lederman, it's a critical review looking at just specifically like things like ab strength and lower back pain. So there's no study at all that links spinal stability to lower back pain. So when I say core stability, so like Pilates based training, even though they're still doing it in a lot of clinics and sending people with lower back pain into it, and yes, they're improving because they are generally strengthening, but there's no evidence to say that Pilates is any better than doing these kind of exercises. But again, it's do what you enjoy. So if someone enjoys doing Pilates and it's helping their back, then crack on. But if you want to train smarter, I would get people to do more of these because they carry over to everyday life. So the squat is essentially sitting to standing. An overhead press, pushing stuff in the cupboard. Pushing up, getting off the floor. You know what I mean? What's 100 of these going to do for you? That doesn't correlate to any day-to-day activity. And then if you look, as well as all these things, your therapist or your GP might advise taking some analgesia, some pain relief, paracetamol, ibuprofen, codeine, tramadol, hopefully nothing stronger, amitriptyline if it's neuropathic. Nice guidelines for chronic pain advises no analgesia, so no pain relief. It's an exercise-based approach with things like acupuncture. So once you've gone through all of this, the physio from the start is looking at what really is the cause. Again, there's no evidence to say that pregnant, like they're having weak abs or core stability is, in pregnancy, or for people with a high BMI is the cause. It's really the excessive load or repetitive load, not weak abs. So causes, again, if you're overweight, reducing your weight will reduce that excessive load and or repetitive load. It might be a work-related excessive load or repetitive load if you're a labourer, or even working in a hospital if you're helping patients out and you're not doing a great good manual techniques. You might be quite stiff, and that might be one of the issues. Inactivity is the main thing with most people, and the cause. You mean you've got back pain because you don't lift. I don't lift because I've got back pain. And then you might be unfortunate that you've had a fall, road traffic accident, or a sports injury. And then in that case, there's nothing in your day-to-day activities that can be changed. Yeah, and that's Robbie. So the main thing out of this video, it's functional strengthening, not core stability stuff. Functional strengthening. So if you've seen me in the clinic, I'm not getting you any Pilates stuff, because I'm evidence-based, and the evidence we're going to go with is a more functional strengthening approach. Cool.